Hello guys, welcome to Baby Ma. I hope you're having an awesome time in your pregnancy and it's a wonderful time, it's a wonderful feeling. You are all getting ready for the delivery. I know, don't be scared of it at all. It's a beautiful experience. You cannot make it beautiful if you're scared of it. Okay, so let's start with the more exciting things. So today we are going to talk about the hospital bag for mommies. Yay! Yes, we have to make a hospital bag for ourselves because when the time comes, you're not going to be packing your bag at that moment. You're going to be in a hurry to reach the hospital on time and just see your trusted doctor and nurses, right? So I'll start with a list of items to prepare beforehand. Ideally, you should keep your bag ready around sometime in the 8th month itself, depending on the condition of your pregnancy. So you should ask your doctor when she thinks you should keep your hospital bag ready and just act accordingly. Okay, so let's start. First, you should have clothes, comfortable clothes for your trip back home. You're going to be carrying a baby, or even if you're not carrying a baby, you would be in a recovering phase, right? It is not going to be very comfortable. You're not going to be athletic. You are probably going to feel a bit of pain somewhere in your body. So you have to choose your clothes beforehand, and it should be very comfortable. In case your baby starts crying on your way back home and wants to feed, so you should be able to feed the baby properly, right, without being uncomfortable, without just having some discomfort or some awkward feeling. So I would suggest to go for some loose t-shirts and loose trouser or a loose pajama kind of a thing. If you don't want to go for a loose t-shirt, pajama, loose suit would do, but definitely wear something in your legs so that in case you want to feed your baby, there's something in your legs, you can just lift your shirt up and you can feed the baby. Or you can also go for the feeding t-shirts. They are really good nowadays. Personally, my baby was born in December, so I had purchased two sweatshirts, feeding sweatshirts. So they had zippers and it was very comfortable for me. By chance, my baby did not feed while on the way back home, so it was more comfortable that way. But yeah, in case you need it, you should be prepared for it, right? Next on, second item is you should have comfortable cotton panties with you. The size of your hip is going to change in the last 2 months. So if you are wearing, for example, small size, otherwise you would probably want to go for a medium size cotton panty towards the end of your pregnancy. A few months you are going to put on some weight in some form or the other, so your panties should be really comfortable. And anyways, you'll have to wear some maternity pad or something, maternity panties. So you need your comfort factor in this area. Right? So go for comfortable cotton panties. Measure your size with an inch tape and then order, or then go for it. Okay, it's easier that way and it's more accurate. Then third in the list is maternity pads. In the hospital, they are going to take care of you. They are going to give you pads, but once as you are about to leave the hospital premises, they are going to ask you to change into your own clothing, right? At that time you will need your own set of maternity pads and cotton panties. Nowadays there are maternity panties also available, so those are use and throw. If your budget allows, go for it. They are a bit higher, like one panty would cost you 50, 60, 80 rupees, something in that range. But yes, that is an option available. So you would be needing maternity pads for a few days. It's a matter of few days. So if you can afford it, go for maternity panties. Those are really comfortable. It's use and throw, so you won't have to think about the leak and blah okay. Next, also you get maternity pads maternity pads are different than the regular pads that we use during periods. Maternity pads are thicker, so it's almost like you're sitting on top of a mountain in between your legs. But yes, you need that during that time. You are going to bleed a bit more. It's going to last only for a few days. So if it's a cesarean, most probably everything would have been cleaned during the operation itself, so you wouldn't bleed much. But yes, there would be, even then there would be some bleeding when the repairing is going on internally. Maternity pads are more suited for this time. Don't go for regular pads. You will need to change them very frequently, so it wouldn't make a good and comfortable choice for that time. The next one is, in the list, the fourth item is feeding bra. Very important item. You need to order it or buy it towards the end of your pregnancy. So if your doctor has told you that it's the start of your 9th month, 36 weeks are over, or 32 weeks are over, and the doctor has said anytime now, then just go and buy good maternity bras. Initially, what my experience was, breast skin became very, very tender, and I used to feel a lot of things. So only cotton and very soft fitting bras I could wear during that time. So there are a few brands that you can try. You get feeding bras of every brand. It's in Jockey, Anamar, Amante, Triumph, and these are good bras. Another feeding bra that I really like is of the brand Taylor and Circus. It's called now and Circus, and it's a very comfortable feeding bra. It will not help you give the breasts a push up, but it's going to be very comfortable while feeding, especially at night. I used to wear it day and night. I have worn it for almost since last 1.5 years. Recently, I started wearing normal maternity bras, such as of brand Amante and Jockey, etc. It's very comfortable. Their cotton is very soft. You should really give it a try, at least for the first 6 months. Your breasts are going to thank you for it. So next in the list is breast pads. Now, if you ask me, breast pads are not very important initially. If the mother's feed is just starting as the baby is born, but sometimes the hormonal changes in the female body is such that the mother's milk formation starts even before the delivery. And if that's the case, definitely you're going to need some breast pads. Now there are two options available. Either you can go for use and throw breast pads, or you can go for the reusable ones. So what I did was, initially I bought use and throw ones because I was just testing everything. But later on I figured it's better to buy the reusable ones. So I bought like 4 or 5 sets of it, so that I was comfortable. I was not at all keeping wet anytime in the day. Anyways, these breast pads are such that they absorb a lot of the milk, right? So and obviously you will need to wash the reusable ones properly in Dettol, in some antiseptic liquid as well. So that's there. It's a personal choice. Please decide. There are many brands, Mimi, Baby Hug, Milo. I think every brand right now is manufacturing breast pads. So just try a few yourself, and you can figure out which one you like the most. It should be very things you should keep in mind while trying the breast pads. It should be very soft on your breasts. You should not feel as if you are wearing anything over them, right? They stick on the bra, on the insides of the bra, but still if you feel the periphery of it, it will be itchy, right? So look out for those things. Okay, so next in the list is a feeding pillow. Now I did not know about the feeding pillow. I had bought the feeding pillow, but I did not take it to the hospital. In the hospital, the nurses, they were very nice, and they trained me how to feed the baby. So they used to put a pillow in my lap, and they used to hand over the baby to me. But it took me a bit of adjusting. Feeding pillow if you have already bought, you can take it with you in the hospital itself. So it's an optional thing, but it's anyways, you should buy your feeding pillow before the baby comes home. It is a must-have in my opinion. At least till 8 months, you are going to be needing the feeding pillow a lot, till the baby becomes big enough of a size that its head comes very naturally in your elbow joint, and the body flows very naturally in your lap. Till that time comes, you need some support in your lap, right? So next up in the list is personal toiletries. The usual stuff. People are sometimes very particular about the toothpaste and the toothbrush they use, and anyways the hospital is going to put it in your charges, right, for the stay. I mean, personal choice, but yes, I did keep my toothpaste, toothbrush, my comb, my kajal, nail paints. Anyways, they are going to remove, so there's no point in putting nail paint just before going to the hospital or getting any nail art done in the month preceding your delivery. They are going to remove all kinds of nail paints from your body. They are going to remove all jewelry. What else? They are going to rub you properly with alcohol. So there's no point in putting any cream or so. You can probably take Vaseline or Borolin or some chapstick for your lips, but I don't think they are going to let you put any cream initially in the initial period. They might allow some oil, coconut oil or something, very light oil, which does not harm your body or reacts to the baby. So personal toiletries are there. Next up is headscarf. So in India at least, it is believed that after delivery you should cover your head, because when you are staying in AC environment and if it is cold outside, if the mother catches cold, it is going to be transferred to the baby. The germs are going to transfer to the baby. So to prevent that from happening, we usually cover our head for the first 40 days, right? The mother's immune system is very, very weak at that time. So even mother is highly prone to all kinds of diseases and all kinds of germs and virus, bacteria, whatever. That's why it is said to cover your head. So keep a nice headscarf for you guys. Ladies, come on, be fashionable. Delivering does not need that you can't look good and feel good about yourself and your baby. So keep a nice headscarf ready for yourself, or a nice dupatta for that matter. Match it with your dress, what you are going to come back wearing home. When you're going to come back home, whatever you're going to wear, match your headscarf with that. So keep at least 2 headscarves, because if you sweat a bit, then it is going to smell. And anyways, I think after using the headscarf for one day, you won't be able to use it the next day, right? And the hospital stay, even if you're having a normal delivery, it is going to be at least 2 days. One day delivery, the next day discharge. So at least 2 headscarves you should have. Then the next is your face towel or your hand towel. If you're very particular about it and you don't want to use the hospital towels, keep one for yourself. A small hanky face towel to just use personally. So that's it. These were the things that I packed for myself when I went to the hospital, and I am sure you guys would be getting a list from your hospital adhere to that, and then just match that with the list of items that I have mentioned. I think more or less it would be the same. Okay, in case of any questions, please do let me know. I'll try to answer it to my best. Okay, if you like the video, please subscribe. Do share the video with your friends who are in this phase with you, and in case of any particular topics that you would want me to cover, let me know. Chalo, take care. Bye bye from Baby Ma.